Well, the first problem is dealing with men. Women, just by their biological function, are forced to see doctors, through puberty, in their early years. They're the ones who are vulnerable to impregnation. They're the ones who are vulnerable to bladder infections and, gynecological infections, some of which are extremely serious, whether it be viral or bacterial. Men really don't live in that world. So that's the first problem, is that they've had no experience with doctors. They rarely see doctors on a regular basis. Probably the biggest fear any patient has going to a doctor is, what are they going to ask me? And most of the time when I talk to a patient for the first time, I usually tell them, tell me about yourself. Tell me what you do. Tell me what you eat. What do you like? What don't you like? What works? What doesn't work? What's giving you trouble? What has concerns? A 5-10 minute discussion like that about a patient will tell you more about the patient than you could ever get on a medical form. I mean, real men don't ask for directions. They'll find it sooner or later. The problem is that you need to realize that there are people with expertise greater than your own that have the ability to help you. And in a capitalist society, that's how this society works. I have a skill set that you do not possess, and therefore it would be smart to pay the few dollars and find out how to solve the problem. Because life is way too short, and the dollars are so insignificant when it comes to the quality of life that you cannot replace the quality of life that you're trying to pursue. I can tell you, in my practice as a urologist, I might be the only doctor they're seeing, and we have a nature of kind of learning how to talk to them, and it's part individual, it's part, the makeup of your personality, but the number one job of a doctor is not to save lives, we just prolong them. It's to alleviate fear and to give them the best quality of life that they possibly could have, and understand the limitations of how the body's designed. I mean, that's really the biggest job we do. I think the other problem is that we are a society that looks for immediate gratification and solution.